What's up, you guys? Today, I want to give you guys a little bit of an inside look at more of like a recovery training day for me. So I'm kind of dealing with a little bit of a groin strain right now, and I want to just kind of take you through a couple exercises that I'm going to do today that are still going to give me a good stretch in there and promote some good recovery, but not be too intense to where it's potentially going to set me back, okay? So hopefully this can kind of be encouraging for you if you're battling with an injury, you're dealing with little ailments here and there. I just want to kind of put these out there. It doesn't have to be super heavy, and I enjoy lifting heavy. It's super fun for me, but today, just the way the day is going, and I still want to get some movement in, but I also don't want to irritate anything. So I just want to kind of give you guys an insight into a couple exercises that could be super beneficial for you, and I'll get in kind of the specifics as I'm doing them. All right, let's get it. All right, so what I got here is I'm going for seated good morning. All right, so this is a really important lift in regards to that groin area, that inner thigh, and then also kind of opening up that low back. All right, so the goal here, we want the feet out, opened a little so we have space to come down. We want to try our best not to round the back. And then just come down, get a good stretch, and back up. You know, when I first started this, I was probably getting about this range, and that was maybe a little over a year ago. So making some improvements, still have a long way to go, but I'm just looking for maybe 10 to 15 reps right here. So just coming through, getting that good stretch, trying to keep that back flat. And as this starts to feel better, you can definitely load it up, but I can really feel a good stretch there in that groin when I do this, but it's not causing any pain. So just keeping that back as flat as possible. Boom. And then, you can also, to get lower, give yourself a little bit of a round, but really encourage to try to keep that back flat. Get that good stretch in that groin, okay? Next thing I'm going to get into here is going to be a split squat, where what I want to do is try to get as much range here in that front leg as I can. Getting a nice stretch on this back hip flexor here. Holding, coming straight back at like a diagonal, okay? So really solid for this knee health. Good stretch in the back hip flexor. Feels good on that groin. Not overdoing it. Just keeping this at body weight today, okay? Right here. I'm just going to do 5 a side. We'll get one more here. Good, and then we'll switch. All right, so there are regressions for these as well. With the split squat, we can always throw our feet up on elevation and use assistance maybe with a bench or a seat or chair. So there's always going to be regression there. All right, and as far as the seated good morning goes, the regression there would be, lowering the weight, but then also you can use dumbbells for that, but then also, of course, shortening the range. So you don't have to get that range, of course, if you don't have it at first. So again, on this left side, I'm definitely dealing with some things as far as the hip flexor goes and the groin. My knee's feeling pretty strong over here, but really have to be careful not to make this worse with that groin strain. Also, 2006, I had a hernia repair, a sports hernia on the other side. So just trying to be really mindful. I'm probably genetically predisposed to some of that. So just want to make sure that I'm smart, because again, I do like to lift heavy, but if I'm just trying to be smart, and I tell my clients this, and I got to take my own medicine, right, is that if I'm going through something, I don't want to push through that problem, that issue, because then it's just going to make it worse. All right, so these 2 exercises today, I'm probably going to do maybe 2 or 3 sets of each, keeping the weight light, just trying to get some movement, some blood flow in there, and then as I feel better, by testing and stuff, then I can kind of increase that. So that was just a little something today I felt like bringing out for you guys. If you have questions, comments, drop me a line. Would love to hear from you, or if you have any insight, on groin strains and things like that. Love to hear it. So thanks for stopping through. Let's get it.